Say, my name is Tina Campbell. I'm a Cree woman from Treaty 5 territory. I am a registered nurse and have been working in tuberculosis care since 2010. I've lived a majority of my life in Inuit Nunanga, specifically at Halloween Nunavut, where I also studied nursing and where I started my nursing career in public health. I've lived and worked in several remote and isolated communities, and I believe this has given me such an appreciation for different cultures. There are so many beautiful cultures and groups just in Canada alone, and I always make an effort to learn about the history of the land and the people wherever I travel to. Currently, I work with Northern Intertribal Health Authority, located on Treaty 6 territory in Prince Albert, Saskatchewan, and I am the Tuberculosis Program Advisor. I began working with TB in 2010 as a nursing student. There were high numbers of TB in the community I was working with. And aside from being diagnosed with latent TB infection a few months before during an occupational health screening, I was unaware that TB was still an issue. It was terrifying to me because I had little understanding about the disease. And it was the nurses that I worked with that worked in the local clinic that helped me ease my worries by providing thorough education. I was offered and started on treatment, which was done 2 times a week for 9 months. So while being a patient as well as being a care provider, I developed an understanding of just how challenging both sides can be. I have worked with Inuit and First Nations on reserve communities throughout my career, and understanding and experiencing the impact that the historical treatment of TB in Indigenous populations has on our people is a huge driving force in my advocacy. I have family members who have attended TB sanatoriums in the 1950s and only recently learned about the horrific experiences while there. Impacts of colonization continue to affect our remote and isolated communities that are heavily populated by Indigenous people. Intergenerational trauma results in negative feelings about TB and a great mistrust of any institution, including healthcare. Being an Indigenous healthcare provider, I find that individuals are more open to trust as well as share information with me when I identify my experiences as a TB patient. Stigma is a huge barrier to TB elimination, and I believe that with awareness and education about TB, it will help us move forward towards eliminating TB from our communities. Additionally, TB is greatly affected by the determinants of health, and communities that I have worked with experience overcrowding and living in houses that are in need of repairs with poor ventilation, which contributes to transmission of TB. Access to care and access to clean drinking water and proper nutrition also affects the health of these individuals. We cannot eliminate TB without addressing these determinants of health, and I take pride in being able to use my voice as an advocate for my people. My experience as a panelist at the UN high-level multi-stakeholder hearing in May was overwhelming, but in a positive way. I say this because when I started my career in TB 13 years ago, I could not understand why this issue was not being talked about more, given the amount of TB that I was seeing in my community at the time. I worked in TB for years without seeing anyone talk about it in the news and even in our communities. I worked with many remote communities and assisted with many community-wide screenings, outbreak responses, and just TB relief work. And when I moved to an entirely different location in Canada, I came to realize that TB was just as prevalent and challenging there as well. So understanding how devastating and resource intensive just one diagnosis of active TB can be in remote and isolated communities, and the collaboration that is needed, I often felt helpless trying to explain to others. It is with the support of groups like Stop TB Canada, in which I currently sit as co-chair, that have assisted and provided me the opportunities and tools to bring these important issues to news outlets, for example. Being able to sit there and represent the Canadian Indigenous population and the impacts that TB has on our communities was the highest honor I have been given. I was extremely proud being an Indigenous woman. I feel like we are finally being heard and considered, and this is huge if we are going to work towards any progress towards TB elimination in Canada specifically. Canada has an opportunity to demonstrate its leadership in the quest to end TB on the global stage at the UN high-level meeting on TB. Civil society organizations, affected communities, and global partners are calling on Canada to take high-impact actions to realize its commitments to eliminating TB both in Canada and abroad. We urge the government of Canada to announce new funding to support research and development for TB. And to meet this demand, Canada must allocate 15% of its total research expenditure to TB research and development to help improve the tools we have to prevent, diagnose, and treat TB, and to address the increasing threat of drug-resistant TB and antimicrobial resistance. We urge the Government of Canada to develop a national TB elimination strategy, developed in collaboration with the provinces and territories, Indigenous leaders, and TB-affected communities that include commitments, guidelines, and the funding required to improve TB screening strategies among high-priority groups. Also, to influence the political declaration on TB, Canada has the power to influence the recommendations in the political declaration that will be endorsed by all UN member states, including specific targets and commitments needed to get the world back on a trajectory towards TB elimination, and to support the involvement of TB-affected communities. The involvement of individuals who have been personally affected by TB is critical to ensuring that the outcomes of the UN high-level meeting on TB directly reflect the needs of the TB-affected community. We urge the Government of Canada to ensure that individuals based in Canada with lived experience of tuberculosis are able to meaningfully engage throughout the UN high-level meeting on TB process by supporting their participation as a part of Canada's official delegation. There is a very strong network of TB advocates. And when you're stuck in wanting to figure out a way to move forward with your advocacy, I suggest reaching out to various groups such as Stop TB Canada. It's a great way to start if you live within Canada, and I know that there's other branches in other countries. You can keep up with events and any progress on current campaigns through our website. Everyone I've met in this network, locally and abroad, are all very passionate and dedicated and are always willing to teach and learn from others. And the more we talk about it, just the more voices we'll have and the stronger we'll become in our TB advocacy. Outside of work, I like to spend time with loved ones, family, and friends. I really enjoy and value my relationships. I enjoy doing beadwork and learning about my culture and my language, because I unfortunately was raised, I didn't speak Cree growing up, so I'm working on regaining my language, as well as staying active. So this year I'm actually hoping to participate in my second half marathon. I did one last year. I said I would never do one again, but here I am. So October I'll be running that, so I'm excited to do that.